remember watching videos of surgery with my father, who was also a surgeon, and just thinking the human body is amazing. And that, from the time I can remember, I knew that I needed to be a surgeon. I chose general surgery because as a medical student, I saw that general surgeons were taking the sickest of trauma patients, cancer patients, patients who were dying in front of their eyes, and taking them to the operating room and fixing whatever was wrong and making them better, and then watching them walk out of the hospital days or weeks later. And that just had to be the greatest thing that anyone could do for someone. When patients come to see me, they can expect someone to be friendly, smiling. I'm pretty low-key, down to earth. I'm a mom of 2 toddlers, so it's pretty hard to fluster me, and I feel like I just roll with the punches, and I'll be sure to show you plenty of pictures of my kids because they're all around the office. My fellowship training is unique, as I'm the only one practicing outside of the University of Utah or Intermountain Medical Center that has board specialty training in trauma and surgical critical care. It brings a unique aspect of trauma care to the area. I take trauma call at Ogden Regional Medical Center, which is a level 2 trauma center, and am able to care for my trauma patients and then any of my patients that would end up in the intensive care unit there, something that no other general surgeon outside of Salt Lake is able to do. Aside from my trauma and surgical critical care aspect that is unique to providers in this area, I also perform colonoscopies. I'm the only female that performs colonoscopies outside of the Salt Lake area. It's a nice component to my general surgery practice, as I also perform a significant amount of colon cancer surgery, so it provides patients a good continuity of care. I then perform minimally invasive surgeries such as gallbladders, hernias, appendix, and our colon cancer procedures. Many of them are minimally invasive. I then also do a significant amount of breast cancer surgeries as well. The most rewarding part of my job is just being able to build a relationship with a patient. My husband, who is also a surgeon, he and I have talked about this on a number of occasions where when you walk into the emergency room and someone is really sick, they've never met you before, they aren't able to choose who you are, but within a very short amount of time, you have to foster a relationship and some element of trust with that patient, that they know that they can put their life in your hands and that you will take very good care of them. And that's something I really treasure, being able to have patients trust me when they're in their greatest need and know that I will do the best that I can for them.